Hallo, assalamu alaikum, good morning, khushamdi, ji ayanu, goedemorgen.
Pakhair agele, ni hao, chune shumme, washwele, ohio guzaimis, guten morgen, hola, boyor, privyet, kaifa hal, hale shuma chatore, ahlan wasal maraba, buna, mucho, gracias, swavika, and a very amazing good morning to everybody who's tuned into PTV World and are watching World this morning alongside the very fantastic, the very energetic, the very pretty, the very amazing Shiza Hashmi and Shahzad Khan. Hello Shiza, how are you doing on a very fine Monday morning over here in Islamabad?
I'm doing absolutely great. Thank you so much for asking, and even better after all the amazing words you used to me. Thank you for that.
Thank you.
How are you and how was the weekend?
Well, I think I'm fine, alhamdulillah, but weekend was obviously no different than any weekday as well. But the only difference was that we weren't on television, even though we were, because we have on Saturdays and Sundays, we have the best of five, you know, that's what we play as well, so that people can get as much information as we have to share as well. But other than that, there's one more interesting bit, and that is that I've been convincing people over this period of time that you're not supposed to go to barbers, you're not supposed to get a haircut, you're not supposed to get your shaves done from outside. But one way or the other, I think people are not listening to us. And
because they need to do it anyway.
Yeah.
So, well,
I'm sorry to say that. And there's a reason. Imagine that one of our members from the team went to a barber, get his haircut done. And while I was in conversation with him, I was like, you know, Jamshed Saab, you shouldn't have done it. He was like, yaar, mere baal kyun aa rahe hain? You know, so whatever it may probably be, ladies and gentlemen, it's a message for everybody out there. You're not supposed to go to barbers because imagine they're using the same scissors, they're using the same razors over everybody. So please, you never know. You know, if somebody did cough, somebody did sneeze, so please make sure that you avoid that as well. And not just that, I think my weekend was great because for the very first or second time, I did my own beard as well.
Oh yeah?
Yeah, I got some help from my nephew and he did help me, and I was like, okay, whether I should pick up on this or not, because beards, ladies and gentlemen, take a longer time to grow as well, and you really do not want to mess up with them.
Right.
But yeah, in that sense, I think my weekend was great. I made sure that I stay back home. I made sure that I prayed 5 times a day. I made sure that I worked out. So I think, yeah, alhamdulillah, everything is in place. But
that's nice, mashallah.
But even you took up lunch, yeah, and you took, and you know, ladies and gentlemen, she was a little risky over the weekend because she traveled to Multan. Why did you do that?
Okay, I'll tell you why. Of course, I had to meet my parents. I hadn't met them after. You know, ever since I got married. But here's the thing. So we didn't stop anywhere. And because we didn't stop anywhere, we covered the distance in less than 6 hours, to my surprise, because all this time I was going there for 9 hours or sometimes 6.5 hours or whatnot. But coming back to what you said, Shahzad, do you realize in all of this thing where you said you did your beard yourself, that we are, as individuals, capable of so much, but because of all the privileges we have or all the facilities that we have, you know, sort of done our hands up that, okay, someone is going to do it for me. For example, if you want coffee or you want tea early in the morning, you'll be like, oh, XYZ is going to make it for me. When I'm up, everything's going to be ready, while you yourself are capable of that. So the only point being, you know, ladies and gentlemen, I feel like this is a blessing in disguise when we say that we're at home and realizing our life in it from a different perspective. So, well, it's fun. One more thing we need to talk about, it's hoarding, or as in Urdu we call it, zakhira andozi. And ever since the COVID-19 situation started growing as well, we have been coming across news, you know, a lot where people or, you know, vendors or shopkeepers, etc., have been hoarding stuff like face masks, hand sanitizer, and even some basic groceries as well. But now the best thing is, Shahzad, the Minister for, you know, Law, Farokh Naseem Saab, Dr. Farokh Naseem said that whoever does, you know, do any of such stuff, you know, hoarding and anything, there's going to be a severe punishment for that. There's going to be fine. He's going to be jailed and everything. So if you know of someone who's doing that, you know where to call and inform them as well, because now, well, Pakistan is going to take care of it.
Exactly. And even if you do not know the website, if you do not know the numbers, ladies and gentlemen, all you have to do is write to us and we'll make sure that we project your request to the concerned parties as well. And I think that this is something which needs to be done, and it needs to be a collective and an inclusive effort as well. But not just that, ladies and gentlemen, one more thing as well, and that is, I'm sorry, Shiza, I'm coming back to this, but Shiza is still getting coffee made by or probably from someone else as well. You know, she's still on that, but okay. Alhamdulillah, thankfully it's her husband, so I think that's great. But other than that, one more important topic, ladies and gentlemen, and that is that a lot of people these days are using gloves, they're using masks, and they're using all sorts of protection equipment. But there's one more thing which made me feel very sorry, and that is that there have been 2 or 3 incidents that I've been somewhere, you know, at a place, and while I was on my way, I could see that people have thrown their masks and gloves just outside their houses, just on the streets, or whenever they're leaving, about to sit in their car, they just throw everything off and that's it, they're gone.
That's
So ladies
not
and
nice.
gentlemen, you're putting other people to risk. Even on surfaces like these, the virus can actually stay for more than 24 hours.
Yeah.
So please make sure that you do not put any other person's life in risk as well. So please make sure not to do that. If you have gloves, all you need to do is that you need take this one bag, you can get it from any shop, and just start putting it in them, and when you go back home, just bin them. So please make sure not to throw all of these materials, because God forbid, we don't know whether we have it or not, we might not have symptoms, and the virus can be on the gloves and on the mask as well, because we might have sneezed. So please make sure to be careful.
Right, thank you so much for saying that, Shazad. That is so essential, but also so basic that we sort of sometimes tend to forget it.
Exactly.
But you know, here's the thing, there are so many times, I'm sure this has happened to you as well, where you probably read something and you were like, I'm not sure if this is fake or true. Who may I call to, you know, make sure if this is fake or true as well? There have been times when you were like, oh, I may be developing some symptoms, maybe. Maybe it's, God forbid, COVID-19, or maybe it's something else. I don't know where to call, or, you know, where to confirm things from as well. So, well, 1122, we know it, Rescue 1122, ladies and gentlemen, is here to help you all in so many different areas that we were not even sure that they are already prepared for that. So, well, to begin with, I think we have the perfect person from the entire team here to actually tell us whatever they're doing on ground and not on ground as well. So, without further ado, let's start the conversation.
Exactly. And ladies and gentlemen, speaking about 1122, which originally, you know, they initiated their services from Punjab, but now, alhamdulillah, they've expanded in AJK, Balochistan, and elsewhere as well, even in Mansehra, KPK, you know, so they're everywhere. And ladies and gentlemen, this is one of those government-provided services which obviously have maintained their standards over the period of time. And it is a name of trust and is a household name. I mean, God forbid, if there's been any emergency within these provinces as well, leave out the federal area, because that's where they operate. All you have to do is call 1122 and they'll be there in no time. There'll be a doctor within the ambulance. But all of a sudden, when the pandemic hit, ladies and gentlemen, obviously the priorities do change as well. So in these times, I think what we really need to know is that how 1122 is coping up, because responding to a normal emergency is different. You really do not have to have any gloves or mask, even though that it's important when you're in an ambulance, you're going to pick up somebody who's actually ill. But other than that, you know, there was no requirement of private protection or probably protection equipment, personal protection equipment as well. But now, ladies and gentlemen, since the pandemic was here, they obviously had to change a little bit as well. And then obviously there were newer trainings which needed to be imparted to people who were actually emergency respondents as well. So we'll be in conversation. And then there's this new volunteer scout service as well within 1122. What is it? What are they doing? And how they are protecting us? Because it's their sole responsibility is not only to bring the ambulance and get the sick. I think in these times of coronaviruses, they are actually looking after people, because they have to take them from home, seal the home, take them into a quarantine. Their ambulance needs to be there. There might be some procedures which we are not aware of. So we'll ask them, and we're very lucky that we've actually been joined by the head of community safety and information, Rescue 1122 Punjab. She's none other than Miss Deeba Shahnaz Akhtar. Hello, assalamu alaikum, good morning.
Wa alaikum assalam, good morning.
First of all, I would love to say thank you to all of you people, to the entire team of 1122. You guys are doing a wonderful job. Please keep up the spirit and keep on doing that as well, because you're saving lives, and there can't be anything better than saving lives as well.
Right, absolutely. And you know, this is the only sort of organization that Pakistanis can trust with a blind eye as well. So to begin with, ma'am, when we talk about, you know, your team, especially in the time of COVID-19, the whole situation, did you guys prepare an extra volunteer team to deal with all of these things? Or are your, you know, the workers at 1122, all your, you know, the rescuers, are they the ones dealing with this as well?
Thank you very much. First of all, I just wanted to highlight the very important component of Rescue 1122.
Yes.
Pakistan Rescue Team, which is part of the Emergency Services Academy, is now UN classified team only in the South Asia, only team in South Asia.
Congratulations.
This is a pride moment to represent those teams as well, and I'm member, luckily I am member of that team as well.
Nice.
And Rescue 1122 was established to deal with all kind of emergencies, and we were trained on it how to respond different medical emergencies, and these gloves, masks were the part of our protocols to respond any emergency. But during COVID-19, what we did, there was a little slight difference, because you need to use the N95 mask, safety suit to avoid the decontamination on your uniform. So immediately at that time in the Emergency Services Academy, there was the batch was under training from KPK and from Balochistan. They have been imparted training regarding the COVID-19 response, how to decon their ambulances, their equipment, themselves, how they can protect. And after that, we have developed videos to train our designated staff in all districts of Punjab. We send them the instruction from safety wing, and then they've been trained on it.
All right.
After that, there are designated ambulances who are actually responding to the COVID-19 patients in all districts of Punjab. Besides that, there are the other responsibilities was given to the Rescue 1122 service, included disinfection. Our fire staff is disinfecting all the areas from where the patients are picking up, and they are sending to the hospitals, even those areas, public places, they are being disinfected. And on the increasing number of the emergencies at 1122 helpline, what we did, we have launched another helpline, that is 1190.
Oh, that is especially for the
Yes, that
COVID-19
is
cases?
yes, because the fear was too much spread, and we wanted to reduce that panic and take the calls and guide the people. Normally we were getting, if they are cough, they are fever, they were thinking it's because of corona. So we tried to establish this 1190, so the people are there, paramedic staff is deputed there, they are guiding them properly. And if there are severe cases like shortness of breath with fever and the travel history, they people are actually being shifted to 1122 with collaboration of the health department. And in synchronized manner, they are being shifted to the hospital. Up till now, 4,803 patients were shifted in Punjab by 1122 to the hospitals and quarantine
centers. And we even want to share pictures as well, so please go on and share these statistics with us, ladies and gentlemen. 1122 at the front line, making sure that everybody's looking after themselves, and they're making sure that they in the first place look after themselves, and then all of those people who are a part of the community as well. The pictures are right in front of you. What a complete evidence. Please go ahead.
Yes, just I wanted to tell you that rescue service is working in all components of the COVID-19. You can see from the shifting from the houses to the hospital, hospital to the quarantine center center to hospital again, if the patients are positive. Then again there is another thing which was the burial, that was horrible for every person, how these COVID-19 patients will be buried. And in that even our people are working, and they have been interested. They are disinfecting the body, they are properly sealing.
We will talk about this in detail, but right now I think what we need to know is that, since this pandemic is it's novel, and not a lot of people knew about it when it actually came into our country as well, or wherever it originated from. I think that let's not get into that debate. But what I need to know is, do you think that the kind of equipment we already had was sufficient to deal with such a pandemic? I mean, let's talk about the ambulances as well, and not just that. I think there are other challenges, because there have been cases that 1122 has actually picked up a person, but eventually, after they've landed in quarantine, they have escaped, or they've gone somewhere else. So how do you think Rescue 1122 actually kind of came up with a strategy where they were able to contain the patients as well? Because if, God forbid, they were COVID-19 positive and the person wanted to go back home, how did you guys convince them? Because there have been cases where people ran away from the isolation centers.
Yeah, people tend to panic quickly.
Yes, actually it's a collaborative effort. First of all, there are two type of things. One is we are getting calls at 1122, and the people are not telling whether they are corona positive, and they just call, and our guys are going in normal uniform, and with those who are not deputed for the COVID-19. In that case, they have been provided safety suits and rest of the personal protective equipment. They ask the symptoms and signs, and see the condition of the patient, and take travel history. After that, they wear the uniform, and then they shift that patient. In another case in which we received the positive corona calls, we call to the health representative, and they send their representative in that area. They said this is the positive, and we have in the list, and then our guys goes and they take that victim and shift them, and they are counseling them as well. And yesterday I was selecting the people for the program. real-time heroes who are actually responding to emergencies. And they said, ma'am, there are a lot of experiences. The real relations are not even touching their own people. And one husband and wife was coughing and having fever. Husband thought that she is suffering from corona. She called us, and when we put in the ambulance, and she said, please come at the back cabin, and he refused that you have corona. And when we shifted to the BBH, and after the checkup, she was found, she's
Are they still together?
she is not having corona. That
Thank
type
God.
of experience is real-time experience. Secondly, our guys are really, because they are touching people. If they are serious victim, they are shifting. Even the burial, everybody has fear. In all cases, they have to touch the victim's body bags, stretcher, and everything. So they are at the risk, and I feel they are real heroes, like doctors and our paramedic staff in the hospital.
Right, absolutely. And ma'am, I'm going to further that notion. And yes, of course, we have huge, massive respect for all the people that are working in your team along with you, of course. You guys are the real heroes. You have all the field work as well. But ma'am, like you mentioned, sometimes they have to deal with the patients as long as they know they're probably not positive yet, or even if they are, they have to deal with the dead bodies, at the burial site and everything as well. So when they have to go to a mission, or let's say you select a team or you select people, how do you boost their morale? I mean, of course, they're doing first-hand job over there. They're going to be present over there amidst the whole situation. How do you deal with that?
And I'm just going to add on to that as well, that, initially when the pandemic was here, and everybody was starting to get to know about it, a lot of people did refuse to come to their work as well.
Yeah.
So, for all of those people you guys are working with, how do you keep their morale up? I think it's a very relevant question. Good question, Shiza.
Actually, our guys are, every day we are dealing 2,000 to 2,500 medical emergencies on daily basis.
Wow.
But in corona cases, and 60 to 80 persons are dying on daily basis, as per our data, right?
But not only corona
these
patients,
are
right?
yes. These are those facts which are being communicated to the people, and our leadership, they have established corona triage center, and they are there, and they send messages, video messages to all Punjab our rescuers, and they said that I am with you, I am there to secure your safety, and I am trying to get more personal protective equipment, and you people have to help the humanity. You have taken the oath. Such type of video messages we have done, and Director General himself actually visited different stations, south, north, and they met with the COVID-19 crew, and they asked, they heard about what are the realities and what they are facing the problems. And in this way, actually, all district emergency officer, rescue safety officers are leading, and they are in the field, and they are actually making sure their safety and training both combine is you can say it gives you confidence.
Of course.
And secondly, the backup from your administration, they always back up you, and they keep up your
So
morale.
the support system is there.
Yes.
Right, absolutely. And
that's
that is actually the backbone of, your encouragement as well, and how you're going to perform too. But ma'am, in the beginning, Shahzad mentioned how utterly important it is for you guys to dispose of your gloves or masks or any equipment that you wear, in terms of to save yourself.
Properly, yeah.
So ma'am, when you said that your team has to go on the field as well, deal with burials and whatnot, please let us know, get us through the entire process of, disinfection after they come back.
I will give you example, Lahore Expo Center, that is the big initiative of Government of Punjab and Dr. Yasmin Rashid, the Health Minister. There is a triage center where the 80 to 90 people on daily basis, they are coming to check whether they have normal cough, and even they have corona positive and rest of the things, and people are being segregated on the basis of the symptoms they have. And if they are good, they have been sent back to home, and if they are positive, then they are sent to isolation center. Our guys are shifting them. And the third category is the serious victim. They are being shifted to the hospitals. What they do, for understanding, I am giving you this example, otherwise in districts this is being practiced. They serious victim, when they are declared from the doctor, our guys are being shifting to the hospital. After coming back, they go to the disinfection process. Disinfection process includes the spray on the whole coverall they have wearing, goggles and everything. After that, dispose of the proper doffing video, which was as per the international guidelines as CDC. We have prepared and we have communicated to all of them, we trained them. They are doing that, and after that, that waste is being disposed of properly in the bags and at the designated place.
Oh, perfect.
I think that's perfect. And at this point of time, ladies and gentlemen, I even want to, I think that this is something which I felt that I should actually convey on television as well. And I think if there's anybody who's listening outside as well, people who are the ones who are actually making sure that Pakistan's future is in great hands. I think that it's going to be a request to all of you that please make sure that you do not use this pandemic or these times for political gains. I mean, I've seen a lot of private media channels, a few of them actually kind of empowering Chief Minister Sindh, and then a few of them obviously sidelining with Chief Minister Punjab as well. Ladies and gentlemen, it's all about saving lives in these times.
Yeah,
I don't think that we should actually be in competition on who did where. But other than that, obviously there have been cases where international organizations have said that Sindh has obviously done their part in the first place, and that too in due time. Not that Punjab has not done it. So please make sure that we do not make it a competition.
Of course, it's
but
not.
Very quickly, I want to ask one more thing, and that is that obviously, you know, it's a time where everybody needs a little bit of help. But you know, the fatality rate for COVID-19, what they say on average is 3%. So out of 100, 3 people might lose their life, unfortunately. But this is not the only disease which Pakistanis have over here. You know, we have a lot of heart attacks every day. We have a lot of accidents every day. We have a lot of other emergencies as well. So do you think that in this time of pandemic, the other priorities are not neglected and they are looked into at the same time and responded with the same, you know, passion or zeal?
Yes, as I have told you that 1190 was started to reduce the panic of such emergencies, guide the people properly regarding COVID-19, and only those people should be shifted who are actually needed the hospital facility. But we are observing since last 3-4 days, last week you can say, we are observing pattern on the 1190 is being changed totally. And first we were receiving the calls of medical, now we are receiving the call for ration. And for that purpose, even Lahore was model in this regard, because Rescue 1122 has been trusted to distribute the ration under the umbrella of Pakistan Development Network, from the Governor House to other from different uses. As we have the infrastructure at strategic locations, and we have rescue scouts 1 lakh in the Punjab, and we have very organized system. What we have done, we have distributed ration at different places. The people are giving us the list of deserving people verified by them, and we just call 20 people at a time, and they are sitting at the marked places with social distance, and get at one time 1 person at the table they are receiving, and in this way we are helping the people, and the paradigm totally shift from the emergency calls to the ration calls.
Thank you very much for saying that you know, there's lesser emergency, but obviously people do need food. 2 more things, and first of all, you mentioned about the rescue scouts, and ladies and gentlemen, it's an initiative taken by them. Then there are a lot of scouts who are actually volunteering. That's one. The other one is that recently there's this video which has been surfacing over the internet, and that is that the same people are getting a larger amount of rations. Now what they're doing is that they're actually keeping it at their homes and then exchanging it with shampoos and other things which actually you can label them as luxury in these days as well. So are you making sure that the kind of data you have, that you're not giving the same ration to the same person on every single day, so that it reaches out to the maximum people as well? And then tell us about the rescue scouts.
The verification of the list is actually the domain of those people who are providing us the list. We are just providing the list of a request list of whatever we are receiving on the 1190. That list is even incorporated in the main list.
Okay.
Otherwise, it is the UC secretary or political secretary, or it is the infrastructure of the government, which they have the zakat committees and everything, and they are verifying it from the different things, different channels.
That's good.
As far as the Rescue Scout is concerned, that is organized team with Rescue 1122, and in all Union Councils of Punjab we have teams, and they are trained on emergency response, they are trained on advocacy, they are trained on rest of the things in normal emergencies and disaster. And during this emergency, what we are taking from the PM side, you have heard about the Tiger Force, but we have Tiger Force in Punjab.
Yeah, we're all tigers.
Yes, we have, they are volunteers, their services are batchless, and without any penny they are providing services to Rescue 1122 because of its trust. And nowadays they are busy in ration distribution in Lahore with rescue service, and in the rest of the districts they are even performing the duties of advocacy and in passing on the instruction from the government.
Wow.
Thank you so much for saying that. Thank you so much for being so amazing and actually heading such an amazing team as well. Ladies and gentlemen, this was Ms. Deeba Shanaz Akhtar. And we were talking about how the Rescue 1122 is actually doing a lot to save you all from any sort of thing going wrong amidst this COVID-19 situation as well. 1122 and 1190 are the helplines that you should be calling in case of any emergency or any information even you need, even telemedicine. So please stay tuned to find out more, because in the next segment we're actually going to talk about people other than this rescue team who are actually doing a lot.
Exactly, because ladies and gentlemen, when you guys will come back, I'm actually going to ask Shiza how was she able to find the same color gloves as the dress as well. I think this is something very notable as well.
Right.
But thank you very much for being with us. We're heading out towards a short break. Don't go anywhere, because when you guys will come back, we have another daughter of the soil who's doing some wonderful work in these times as well.
Absolutely.
Let's take a look.
Good morning.
All right, ladies and gentlemen, welcome back. For everybody who just got tuned into PTV while you watching World this morning alongside Shiza Hashmi and Shahzad Khan. Earlier, ladies and gentlemen, we were in conversation with the spokesperson of Rescue 1122 who actually had to share a lot of success stories within these times of pandemic, where there have been people, where there have been volunteers who just want to help other people. And I think that this is the best thing to have heard early in the morning.
Absolutely.
But not just that, ladies and gentlemen, very quickly before we move on to the other part of the conversation, where we are actually going to let you know what to do with kids these days, how to engage them. But before going towards the break, I wanted to ask Shiza whether how did she get the same color gloves as the dress? So yeah, where did you get them from, Shiza?
All right.
And was it on purpose?
No, not actually.
Okay.
So you know that whenever you go to
And I just figured out not just the gloves, even the eyeliner is the same color as well, or whatever you call it.
Okay, yeah, I love blue. I'm obsessed with blue. But
Yeah.
here's the thing, we only get gloves in white or blue, right?
Yeah.
And the person who was selling it said that the blue ones are better. So
Really?
hey, yeah, I'm more
Okay.
protected than you are.
I don't know. I
On
mean,
a lighter note,
you
ladies
do
and
not have to
gentlemen.
use gloves for eating food, you know. You
Oh,
just have
of
to cover
course.
your hands or whatever
Yeah,
it
but
is.
maybe they can penetrate germ scan. No, I'm kidding. I don't know.
Maybe.
I'm just saying.
I mean, it's airtight. I don't
Yeah,
know.
absolutely. But
But
ladies
yeah.
and gentlemen, make sure that if you do go out, and even if people come to your house, first of all, they should not. If
They
they,
should
do,
not, yeah.
make sure that you're fully covered. So here's the thing. In the first segment, like you mentioned, Shahzad, you know, the government and states' responsibility is actually to look after its people, and that is what it's doing in terms of, you know, rescue operations, making helplines, hotlines, even whatnot. But people, general public is actually coming up and doing a lot of volunteer work as well. For the past 2 weeks straight, Shahzad, that is what we have been discussing. Sorry, I'm out of breath. In
problem.
our second segment especially. But here's the thing, the organization, let's say, or the non-profit organization, yes, that we are going to discuss today, is actually sort of different because it's not doing rescue operations on ground, or it's not, you know, doing the Russian work. A lot of people are, that's amazing. But there must be someone who should do, you know, the discourse, set certain discourse
Yes.
amidst this time for people and children, for parents especially, to learn what to do, what productive things to do when they are at home. So basically, this is a community development project headed by some amazing people. We have one of them over here. And the project itself is called Pehchan Pakistan.
Yeah.
So this basically inculcates a sense of identity and patriotism in the youngsters of where they belong to and what they should do for the homeland.
Shiza, I'm impressed by the kind of information you've given away as well and imparted. And this year around, ladies and gentlemen, it was all about your mother tongue as well. But unfortunately, since COVID-19 is here and everybody's responding to that, so obviously they have put a stop to it, and which obviously they're going to regain the access.
Yes.
But now, for now, I think what they're doing is wonderful. They're actually educating parents. They're educating people who are members of this community, whether how to engage your kids, whether how to engage your parents, and how to have a healthy life even when you're staying back at home. So, ladies and
And it's
gentlemen,
possible, I tell you.
yes. So, ladies and gentlemen, the smile she's carrying, I think, tells us everything about it as well. So, without any further ado, we are actually going to put the camera on that beautiful smile. Ladies and gentlemen, she's an educationist, she's a trainer, she's a social performer as well. She's from Pehchan, Pakistan. She's the founder. She's none other than Meera Malik. Hello, assalamu alaikum. How are you?
Assalamu wa rahmatullahi wa
Welcome back.
barakatuh. Thank you so very much. And I'm brilliant. Alhamdulillah. for
Thank
that.
you very much. Jannatul halalu wa dozakul haram. Alhamdulillah.
Right.
Thank
So,
you very
ma'am,
much
to
for
begin
joining
with,
us.
I think, first of all, we sort of just gave a small introduction on what Pehchan Pakistan is. For people's better understanding, please go ahead, especially in COVID-19, what is Pehchan Pakistan?
Initially, we started off Pehchan Pakistan as a project for students aged 3 to 22 years. It's a platform for students to engage in creativity and to promote patriotism. Pehchan Pakistan is supposed to be a open contest for students, right? And this is the only inclusive contest for students in Pakistan because students from the special education institutions participate in it.
Oh,
So that's
amazing.
it's a huge thing, and we would like to, you know, make it inclusive where everybody can be part of this. And as you said, the theme for this, we were about to inaugurate it on 23rd March. That was Meri Zaban, Meri Pehchan. Unfortunately, we could not.
Okay.
But then again, we thought there are other ways to contribute,
Yeah.
right? So what we have done, if you visit our website, pehchanpakistan.org, so what we try to do, the entire team, we have given activities for parents according to age level, starting from toddlers till teenagers, and how to engage them at home. You know, it has activities, it has logs, it has routines, it has you know, how can you engage them in creative activities and yet enhancing their learning skills.
Oh,
So,
nice.
you know, this is a blessing.
Yeah,
You know,
and we have it on the screen as well.
oh yes, and you know, so many parents ask me, so you know, I'm
Prayer
sure you know
log, wow.
children are driving them nuts, yes, but you know, the first and the foremost thing the parents should do is to establish routine. That's go back
Yeah,
to slide
let's go
number
back to
one.
the first one and then we'll move on
Is
with
to
that.
establish routine, people. It's extremely important to have a routine. We do understand, you know,
Right, of course.
you know, everybody is awake till midnight and probably beyond that also,
Yeah.
and we are waking up in the afternoon, and then we just don't know what to do with the rest of the day. So establish a routine. There are a lot of institutions who started off with their online classes,
Yep.
and they started at 8 and they're ending at
Oh,
1.
I have
That's
a quiz
brilliant.
today.
And
Thanks for
let me
reminding
guess,
me.
I think that the next slide would be, you know, okay, establishing routine, and the next slide would be delegate change.
Delegating chores, yes.
Okay, yeah, let's
Chores
do the
involve
delegating chores.
all family members. What's happening actually, if you go through the social media, all the mothers are busy in kitchen.
Yep.
I mean, they are going off board trying to satisfy every member of the family who likes what, and they're experimenting with new recipes. And then, you know, you can't really expect them to do everything from cooking, cleaning, and so many of us have, you know, relieved our servants or, you know.
And I don't know why, but my mother's always coming up with keema karele, you know, something of that sort, you know, so if we can have a little bit of change, I think that's great as
No,
well.
but I want, you know, Ms. Miran, when you talk about delegating chores to each and every family member, it's a fun activity, to be honest, because when you sit together and decide what you're going to do. So I want you to elaborate in that as well.
Yeah.
And
Supposedly-
especially what is on your website. I mean,
What's
when we
on my
do
website?
yeah.
If you go, you're going to find a chart for the home chores according to age. Like supposedly for a 5-year-old, he can help you in setting up the table, he can do some dusting, he can lay down the table, he can be there with you, assist you in the kitchen,
Right.
or maybe make their beds.
All right.
And at least the ones who are 7 plus, they should
Absolutely.
be able to at least clean their room, you know, organize their cupboards. You know, the little things matter. And I'm
does.
sure these little things, you know, would add so much value.
True, true.
they do.
And I feel a lot of shame because, ladies and gentlemen, I've been, you know, more than 7 for a longer period of time now, but I haven't been doing it. But very quickly, let's move on to the next slide.
Yeah,
Okay,
right,
so
next.
So-
after delegating chores, the next slide is?
Lift your mental health.
Yep.
Oh, so
This is the
important.
best time to do it. I mean, from, you know, make quizzes with them, ask them mental maths questions, and don't go for those routine questions, you know, asking them 2 plus 2. Probably, you know, just engage them, tell them 3 rickshaws, how many tires, 2 birds, how many tails.
Yeah,
you
that's
know,
good.
get them a little thinking a
Right,
little.
right, right.
Or probably I Spy game, it's so popular.
It's so much
and you
fun.
can just do it, you know, with your family members. And in fact, what I'm suggesting everybody these days, take out your albums.
Oh,
you know,
yeah.
take out your albums, talk about the family. There has been an event there.
Pictures are horrible. I don't want to look at them.
Oh my
man.
God.
Look at
you
it.
know.
So you're going to teach them adjectives.
Yeah.
You know, I looked horrible.
Oh, okay.
I was skinny.
Yeah.
I wasn't popular. You know, all those stuff.
Yes.
So it adds to the vocabulary. It's add to the comprehension, and yet you bring them closer to your family.
Yeah, but I
Right,
did
so
ask
many-
my daughter the other day, and I was trying to be very, you know, kind of out of the box, and I was like, Shabano, come on, tell me, what is 196 square? And then she was like looking at my face, and then she was like, what are you asking a 6-year-old?
Exactly.
And I was like, okay, you need to figure it out. But that's nice. I think that's something which needs
Right,
to be done as well. But let's move on to the next slide.
Right.
Yes. So the next slide says, ladies
one
and gentlemen,
says manage your anxiety.
whoa, this is difficult.
How can we do that?
Yeah, what's happening, it's not only that we freak out the moment somebody sneezes at home, but so many of us are going through some financial constraints actually.
Of course.
All of us.
All of us actually.
Yes.
And we are yet blessed
Yes.
not to face the kind of, you know, the people are standing in a
Inconvenience, yes.
queue and collecting ration. But yet, you know, don't let that anxiety spoil
What should we
you.
do?
What should you do?
Okay, I
One
didn't get
thing,
paid this month. What should I do?
Inna Allah ma'as sabirin.
Alhamdulillah.
So, one of the things.
Yeah.
But the thing is that, haven't we prioritized everything now? You know, we have taken this opportunity. We know exactly what to eat,
Yeah.
and we have stopped going out. We are eating healthier, and we are more closer. And don't you see that, you know, the budget has fallen down actually. We have cut out a lot of budget from, you know, the extra going out, shopping, eating, hanging out with friends and everything. So I'm sure we are going to go through this.
Yeah.
Just stay positive. And do not let this rub onto your child.
Exactly. Thank you very much for saying that, because
So
ladies and gentlemen, I think that this is the most important aspect of this conversation. And we did become very worldly, you know, because we didn't have any of these things as well. Everybody wanted to go out. Everybody wanted to wear designer clothes and have designer bags. But wow, you cannot show off your designer clothes and designer bags because you cannot go out. So it's
well,
better.
I can on Instagram. No, that was just a joke. But here's the thing, ladies and gentlemen, I think Miran, you rightly said, where we're saving so much as well.
Yeah.
You know, Shazad, just my parents were like, okay, I feel like you mentioned, you know, there's a delay in our salary as well. So we're like, I'm still, you know, sort of coping with it in a good way. So because I had a lot of savings somehow for this month. And my parents was like, oh, it's a good impact of your wedding on you. You know, that is how people mature. I was like, dude, it's not the wedding. Trust me, it's because of the COVID-19
You know, and I was
no
actually,
one's going out.
yeah, I was actually looking for a dear friend who actually had a lot of savings on them. I think I've got one as well. But yeah, thank you very much. But quickly, moving on to the next slide. Yes.
Yeah.
All right.
So reducing anxiety and controlling
is
anxiety.
limit screen time, particularly news. And there's so much of fake news being circulated. Have you seen that one, you know, where they're showing this guy jumps off a building, and, you know, the caption said he committed suicide because of COVID and he lost all his family members in Italy.
Oh, God.
That was absolutely fake.
Oh, wow.
And it's circulated like anything. It's going to add to the anxiety.
Of course.
And limit screen time. Giving mobile phones or tablets to your children who are way too young, you're actually harming them. Isn't this the time, you know, you can actually bond?
I think this needs to be done with mothers too as well, you know, for all of those mothers who have finally learned to use WhatsApp. They're becoming doctors on their own. You know, this was on my WhatsApp, you couldn't go out. Mom, come on, they just got tested, they can come to our place. No, nobody can come in.
Right, but ladies and gentlemen, you know, this is the time where a new term came out. It's called information hygiene. And the only purpose for this coming out and, you know, for you guys, for me sharing it with you guys is where you said, Miran, you know, a lot of fake news is going on. Of course, you're on your phone all the time. We understand you're not going out. So phone is most, you know, the most entertainment you have.
That's how you go out these days.
Yeah, but there are a lot of platforms that you're using and you are getting a lot of information from each and every single one of them without you knowing if it's true or not. There are certain ways where you can, you know, make sure if it's fake or not. But for the most basic part, think to yourself, if you don't have enough facts to back the story up, do not share it further. I mean, this is, when you say hygiene, this is how you stay clean of fake news. And staying clean means a healthier mind as well.
Exactly, because ladies and gentlemen, we go through this process every day because the kind of information we get for you, we actually have to make sure that we challenge the same source over and over again, and then make sure to say it over here on television as well, because it is greater responsibility. So for all of what you're sharing, make sure that it's authentic. Quickly, moving on to the next slide. We're not left with much time, so let's do it quickly. Yes.
Okay, this is it. Practice precautions, wash your hands, stay away, keep neat, keep yourself clean, exercise social distancing, and so on.
Wow.
Brilliant.
This is the only thing that we can do at the moment.
And you know, these are basics.
Stay positive.
True, basic, but you need to hear them from someone, you know, to actually do something about it as well.
Absolutely.
All right, this was brilliant, Miran. This is absolutely amazing for you to actually be giving out such kind of information and available to everyone, right?
Thank you so very much. May I add that Pehchan Pakistan has started off a podcast, Stories from the Quran. For the students, you can go and, you know, listen to that. And since our Pehchan Pakistan's theme, Meri Zaban Meri Pehchan, we could not carry it out, so we have started a podcast for that also. So we're picking up classical passages from Urdu literature and we're trying to put it there. So, you know, once
just yesterday, my husband and I were looking for better podcasts, you know, to spend our time. I know where to go now. Thank you so much.
Thank you so very much.
Thank you very much for joining us. And you know, Allah kare that soon all of this is over and that you get back to making sure that everybody is patriotic enough and that you are actually involved and busy with promoting the mother language we have, Urdu, which it is, ladies and gentlemen. So this is it for today. But obviously there's a lot of information to take away, ladies and gentlemen, and our sole motto is to provide you with that information. We do not have that masala in our program as well. We do not have dances.
And we won't ever.
Yeah, and we're never going to do that. It's not just the PTV thing, but I think that this is something our teams decide upon as well. But your feedback obviously is a must. Please keep on writing to us as well, and we always make sure to listen to all the critiques who are out there as well. So yeah, you can say whatever on our Facebook fan page, which is with the name of
World This Morning.
On Twitter.
World This Morning without the G.
On Daily Motion.
World This Morning.
On GTube.
GTV World.
And the fabulous repeat is going to be at
5 past 11 p.m. tonight.
Till the next time, 1, 2, 3. Good morning.
Good morning. Take care.